So it's not the easiest thing to be the last speaker in a session, especially not before lunch, but I really will try to keep time so we can go and just have a break. So when we talked about and thought about what would be really interesting to just study a bit more, we came from our practice and experience in Hungary, but we really wanted to explore and understand a bit better if this is something that is still happening in other countries at all, or actually, as Bill said, it's just moved away from that practice. So what we wanted to really just understand a bit better, whether it happens, and if it happens, why it happens, that family caregivers are discussing still more these issues with professionals and not patients, and also what it means for the family caregivers. So in the InSup-C project, as you already saw earlier in more presentations, examined patients, family carers, and professional caregivers' views, and we focused on communicating about issues towards the end of life, and also how patients and their family caregivers are satisfied with communication and involved in decision making. So you saw this, and I think it's really important that also just we have a bit of understanding that we used validated questionnaires and also semi-structured interviews, and also as a third group interviews with professional caregivers. You can see how we structure that, and actually what we will use this here today is the baseline information and interviews and questionnaires, so we will talk about this today. So the aims of this research or study is just really learn a bit more about the aspects of good and bad communication, planning for the future, and communication with family caregivers. And we just really wanted to see a bit all the three perspectives, so the patients, the family caregivers, and also the professionals' point of view. So if you look at this figure, it's how satisfied are you, that the doctors really explaining about your illness, how straightforward and honest manner in the past month. And also, this question is from the Can Help Light, how are you satisfied that the doctors explaining things relating to your relatives' illness in a straightforward manner during the past month. So if you look at this, you can see that actually the majority of both patients and caregivers are very or completely satisfied. So it's 75% of them. So you could say it's not too bad, but also we need to look what this other percentage who are not satisfied or somewhat satisfied, what the reasons could be for that. Also, it was another question in the same questionnaire, how satisfied are you that the doctors listened to what you had to say during the past month? Also, similarly, we found that most of the patients and the family caregivers are very or completely satisfied. So these are the aspects of good communication care, and this was really something that across all countries was also noted, and this is something that is not really new, but we wanted to go into more understanding what are the sort of bad aspects of communication. And surprisingly, we found very common themes, very common topics that they were really represented in most or all of the countries. So let's see what are these. So one point, it was the constant repetition of information. So information transfer is very important. When you go to another setting, you have to start all over again. What's the matter with you? So professionals giving different information. That is a very bad situation. One doctor says, I take the medication for 5 days, and the other one asks me why I stopped after 5 days. And these are in more countries are just repetitively there from the patient side. We were really surprised that the paternalistic practice that we thought is just only still exists in Hungary, we really could see examples from all other participating countries. So then you are in the hospital, the physicians come together, sit around the computer, and then they talk about you. But I couldn't hear a thing from what they decided. It came to me via, and I was like, stop, it's about me. Then another one from the UK. When I saw the consultant, he just said, no, you are not going to do any paid work. Then wouldn't tell me what it had gone, the ejection fraction, it's a cardiac heart failure patient. And he said, no, because you will just worry about numbers. Hungarian example, here in Hungary, they don't ask anything from the patient, they just treat you. Also, another element that came back more times is talking in jargon and, not just the lay language of patients and people. So healthcare professional language is probably alien to most people. They still don't really speak in the layman's terms or explain what they mean. It's also from the UK. The communication could be more open. For example, during the visit at the hospital, the head physician and my doctor tell each other everything in Latin. Why not Hungarian? So also another example from Belgium about sometimes the timing of sharing information about sensitive topics is really can be disappointing and frustrating for patients. So the woman at the hospital shouldn't have done it really, but she says, oh yes, there is definitely something, there is, and it's on your bowel, which upset me really. So what were the aspects of bad communication from the family caregivers side? So lack of honest communication, one example. He always holds out false hope to us, pretending it's nicer than it really is, and it goes on. And the other, that it was really coming back in most countries, the absence of proactive approach. They don't sort of keep you informed as such. It's just sort of, rather than them telling us, we have to ask them. So what we also recognized when we were reading the interviews and these aspects of communications, that actually there were differences between professional caregivers and definitely those caregivers who are in hospice, they were really valued how they communicated with patients and how they provided information. So the palliative care home care nurse came back, and when my husband was around, because I had some questions about dying. So we sat together, we drank a cup of coffee and talked about dying, funeral, and so on. And now we are able to talk about it better than before. This is a Belgian example. So how does the hospice doctor can help you? For example, we can talk about lots of things. It also helps our family things, and then I tolerate easier my problems. Of course, my husband also sits there and talks. He is a very good partner in this. So I think this is much appreciated, and in more interviews and in more countries, hospice care providers are really providing these good examples of communication, which is much appreciated by patients and caregivers. Also, what it was more times that coming out that specialists have more difficulties communicating than GPs or nurses, especially hospital doctors have the tendency to be more paternalistic and use more medical jargon. The communication skills of the doctor were zero. He explained what he thought he had to explain, but in medical jargon and very narrow. So also, in the Can Help Light, this was a question about discussion the preferred place of care, and you could see that only 45% of patients responded to that question, and those who responded, they were still very or completely satisfied. A little bit lower numbers with the family caregivers. Also, discussion about life-sustaining treatments. The respondents to this question only were 36% of the patients responded to that question, and the satisfaction was similar both of the patients and family caregivers. Then, also in the Can Help Light, it was a question about future wishes and how satisfied the patients and the family members were with these discussions. And you can see it's quite a big difference. So patients were much more satisfied with these discussions, while family caregivers much less. And actually, here you could see that higher percentage of family caregivers were somewhat not very or not at all. So I think this is important to note. Then also we just went into the professional caregivers group interviews, and we just tried to explore what could be the reasons why professional caregivers discuss with family caregivers and not with patients some of these questions. So patients sometimes gave the family caregivers a mandate, a right, authority to decide when they were for some reason not able to do it for themselves. Or the other example, patient doesn't want to know. So it's an example from a German group interview. Some don't want to know at all, and they ask for from the start not to be told how long they are going to live for, because they would always hang on to that day. Another example from UK, and there are people who don't want to know. Also, family caregivers does not want the patient to know everything or just certain things. So when you leave the house and a family member will follow you outside and say, can I just ask you this? Or can even to the extent, can you not mention this about the disease and about the progression? Also, an example from Hungary, communication can be difficult when the relatives ask me not to tell the patient how serious his condition is. In that case, I would say that if the patient does not ask, I will not make a statement about it. And I was really surprised by this one. So in some places, this is just a practice of communicating. This is an example from Germany. So where these patients come from, the custom is that only the relatives are informed about the diagnosis, who decides what the patient will learn and when. I think this was very important information for us because we had already had a few cases like this by then, and we often failed with this like these things. So I think this is just like a practice that they just say it to the family caregivers and not to patients. So we were really surprised by that. So just a discussion point. So we can say that the majority of patients and caregivers are satisfied with the straightforward and honest communication. But paternalistic practice is still present, not just in Hungary, but in the other countries we were working together. And also repetition of information can be really frustrating and causing anger for patients and caregivers. Just think about these are patients who are having chronic conditions, and it's just really tiring for them to repeat information. And in some calls it was even mentioned, why can they just really read the notes from before? Why can't they just take this couple of minutes and just, I don't want to say it over again and again. Also, the contradictory information can cause uncertainty for patients. Jargon, that they don't speak the lay language and they just use medical terms, and also lack of proactive communication. So also just communication differences between the professional caregivers. So it seems that hospice care providers are really much better in communicating, in really just giving information on a way as it's well perceived and it's appreciated by patients and caregivers. And the other groups who are not in hospice or more hospital-based clinicians, they are much likely to satisfy these needs of the patients. Also, we can say that family caregivers are less satisfied with discussions, and family caregivers have more communication stress. I just made this term, and I asked my English colleagues if she said that it makes sense that actually family caregivers having more communication stress because they are more informed or they have better understanding what's happening really, and also because these discussions with the patients sometimes can be really distressing for them. So some just concluding points. So we believe that communication skills teaching is still very important, but maybe we would need to shift and just focus not only how to communicate with patients, but also how to communicate with family caregivers. I think this would be really important. And also the importance of information sharing and handover, it was already mentioned earlier today. Proactive discussion approach should be integrated into everyday practice because this is really much appreciated by most patients and caregivers. It's very clear that the support for family caregivers should be more, so we focus on patients, but I think we need to have a bit more focus on supporting family caregivers, and future research needing to be explore the needs of family caregivers for additional support. So thank you for the InSup-C team to have this 4 years working together. We learned a lot. We had hard times and we had just really challenging times, but most of the cases we had just much fun. So thank you so much.